Thank you for joining us. I'm Ruby Gill for Gitxsan News. I've been working with the Gitxsan government last March, working with the communication staff to help launch communication initiatives such as creating your own media platform like Gitxsan News, giving the ability for Gitxsan to tell their own story in their own way to their own people. The Gitxsan News staff are currently social distancing and practicing self-isolation given the COVID-19 virus that has taken over the country. And I've been temporarily stepping in. Thought it would be timely to launch the station, so we've been doing it at an arm's length, obviously, and very virtually. The follow-up to last week's story, this week we are talking with Ska'yan, Anita Davis, who is a Hereditary Chief for the Gitwangak. And what I wanted to ask her, she's on the other line, is Anita, can you tell us why this issue is so critical for the community?
Sigidimhanak of Ska'yan wet the Anita Davis wetty that's all get sakab dum lase will dagam hasib and medzel we ali lach anzak coronavirus wetwist. COVID-19 is considered a critical issue for our community of Gitwangak because it appears to transmit through family and close contact. Gitwangak, like any other indigenous community, are much more vulnerable. We are close, we are small, we're close-knit with overpopulation, we have overcrowding in our housing, we have numerous members with health issues, we don't have local doctors or hospitals. The nearest hospital is 1 hour away, and that hospital services other surrounding reserves. We have 80 precious elders living on reserve, and that is what I am totally concerned about. They're our gold. They're our knowledge keepers. So we have to protect them and keep them safe.
Thank you, Anita. Those are some very significant and some very scary statistics. Can you also talk about what you're seeing in terms of behaviors, and are people and members following guidelines? What is your experience being on the ground?
If COVID-19 hits, it will spread like wildfire if it hits our reserve and potentially wipe out up to 40 to 70% quite quickly. We have 450 members on reserve. That works out to 180 to 315 members. It'll have a detrimental impact on our reserve. And a vaccine is not expected till early 2021.
Thank you, Anita. And as a Hereditary Chief, what message would you like to send to the community?
Other outbreaks of diseases like smallpox and the Spanish flu almost wiped out our populations in the past. So this disease is critical because not enough people are taking it seriously, specifically the teenagers. Our young people are coming and going, socializing, just acting as if there is no pandemic, and that is serious. That is risking our elders, our community members, all our people. As a Hereditary Chief, the message I want to give to the community is this. We need to make sure we are not spreading the virus. We not only need to flatten that curve, but we need to eliminate it by practicing physical distancing and acting as if we have it. This is for the health and safety for our families, our kids, grandchildren, elders, our whole community. And we as leaders need to remain calm. I'm pleased and inspired to see what what community members are practicing. They're adapting, they're making changes, life changes. They're taking this as an opportunity. Although we've postponed feasts, stone moving, song and dance, other cultural gatherings, our people continue to be productive with smoking ulikans, and people are planning out harvesting medicinal plants that will be in season soon. People are planning out how to spend more time out on the Lahyip, our lands, and that makes me extremely happy because that's where I practically live and would rather be, so I can attest to how healthy that is. Today I interviewed Git. I asked him a couple of questions. I asked him, what does this all mean to you as an elder of Gitwangak? And he stated, well, there used to be thousands of us from here, and we died off from foreign diseases. In the olden days, when they know there's going to be a strong sickness coming, our people moved amongst the jack pine. Most of the villages around today are situated close to where the jack pines are growing, and that was their hospital. I asked if he had any advice for our communities, our members. He stated, keep doing what our ancestors taught us to do. Get your own medicinal plants. That's the one thing that the Creator left for us, and it still works today. So I really appreciated that advice. I learned a lot from one of our Samagits of this community. So my message to the community as Ska'yan is this: we will get through this together. Prevention is paramount here. I want to see people just keep singing and dancing and challenging your family and friends to karaoke, and keep smiling, because this all helps our immune system.
And there you have it, a very important message coming to members from Ska'yan, Anita Davis. Thank you for joining us, Anita, and thank you for tuning in. As the issue develops, we'll do our best to keep members informed.